So that was a 52-year-old male patient who has been diagnosed with CLL in 2005. So at that time point, we didn't have much options, but in the next 3 years, he progressed and started treatment with the fludarabine cyclophosphamide, which did put some improvement on him, but after 3 years, we had to repeat the treatment, but added rituximab. For some years, he was okay, but in 2015, he really progressed with high CLL burden, very symptomatic disease. And at that time point, we knew that in 2014, Ibrutinib was approved, but we didn't have it still in Croatia. So we applied the patient for Ibrutinib compassionate use. At that time point, he had positive serology for hepatitis B infection. And as we knew, the resonance study excluded these patients. But we were pretty desperate, as well as the patient, and we started Ibrutinib in reduced dose of 140 daily. 10 years after, the patient is great and still continues with 140 and with antiviral prophylaxis.